The total number of active COVID-19 infections across the nation has dropped below 500. Those numbers come as the federal government ramps up pressure on some states and territories to remove border restrictions, saying the closures are crippling the tourism industry. So here are today's developments in the coronavirus story. The Prime Minister will use a keynote speech to outline the government's plans to reset the economy. Scott Morrison will unveil a new Job Maker plan aimed at simplifying training and skills. In South Australia, the easing to Stage 2 restrictions has been brought forward a week to Monday. And in Victoria, the youngest and oldest students are returning to school today. Human trials for a potential COVID-19 vaccine get underway in Australia today. Tests will begin in Melbourne before the trial is expanded to Brisbane and will involve about 130 healthy participants aged 18 to 59 years old. The World Health Organization has suspended the use of hydroxychloroquine in its global study into experimental COVID-19 treatments due to safety concerns. And Japan's government has lifted a nationwide state of emergency, removing disaster declarations from Tokyo and 4 other regions. Well, there's been a positive case of coronavirus at Waverley College in Sydney's east just one day after students across New South Wales returned to classrooms full-time. Reporter Jessie Dorset joins me now in the studio. Jessie, what do we know?
Good morning, Ros. Well, this is a breaking story. We've just learnt about it in the last hour and we're learning the details as parents of Waverley College are finding out. A student at Waverley College in Sydney's eastern suburbs has tested positive to COVID-19. We understand that person is part of the senior campus. Waverley College is an all-boys school in Sydney's eastern suburbs. Yesterday we were here talking about the return of schools across New South Wales full-time. Well, now parents at Waverley College are being asked to pick up their children as a precaution. We've seen a message believed to have been sent to parents. It says that a student of the senior campus has tested positive. As a precaution, they're asking parents to collect their students, their boys, as soon as possible, and the school has nominated an exact pickup point for that process, Ros. This is the first confirmed case of COVID-19 at a school since the return of schools across New South Wales. We understand that health authorities are now going through the process of tracing who had contact with this person. We know that they're now in isolation. And when we've seen similar situations, students or staff testing positive at a school, those facilities have been deep cleaned. So I think it's fair to say that process will happen at Waverley College.
Thank you for the update. Human trials for a potential COVID-19 vaccine are beginning in Melbourne today. The trial is one of only a handful worldwide and the first in the Southern Hemisphere. Elias Klur reports.
About 6 people are going to commence this trial, 6 of about 131 healthy participants. Now, they're going to be injected with a virus substitute. It's not the actual virus, they were very keen to stress today. And then the vaccine, which is being manufactured in Baltimore by the Novavax chemist company. So we've spoken to the doctors today. They're very confident. They've tested this with animals and say it was very promising in terms of the results, and they're looking forward to the first trial, which is expected to end at around July, and then perhaps the second phase of the trial later in the year. Now, Dr. Glenn today said that he expects that 100 million doses could be available by the end of the year, made available to the rest of the world. Now, of course, he's from the company. He's going to spruik how good this is, but he said he's very confident that this could be the silver bullet that is distributed around the world as the coronavirus vaccine. So promising signs early from the animal testing, and now it's time for the clinical testing. As I said, the first in the Southern Hemisphere to do a clinical trial and one of 11 around the world. So it's a significant day. The government has been spruiking the fact that Victoria is the medical research capital of the world, and we've spoken to Nucleus Network today and they said it's significant, of course, that it's been conducted here, but also in Brisbane to ensure that any missteps in the first phase of the trial in Melbourne are sort of alleviated in Brisbane. So it will be conducted over 2 locations, and then when phase 2 commences, it's expected they'll recruit about 1,000 participants. And interestingly enough, they said today that it wasn't that difficult to find people willing to inject a substitute virus and then the vaccine, which is interesting. I mean, it's probably not something people would jump to sign up to, but they said they had no difficulty in terms of finding the 139 participants for the first phase, and as I said, expecting to see a result from the vaccine in late July.
The South Australian government has decided to bring forward the move to stage 2 restrictions to next Monday, a week earlier than planned. Reporter Helen Frost joins us now from Adelaide. Helen, what's going to be open then in Adelaide?
So what we'll see is we already have bars, cafes, restaurants that have started to reopen as of Friday with 10 people inside and outside. But from next Monday, we'll see bigger venues able to have up to 80 patrons, but that's 20 people per room. There still has to be 1.5 metres between people and the 4 square metre rule. But on top of that, we'll have beauty salons back open, we'll have nail bars, tattoo parlours and things like relaxation massage. We've been able to have remedial massage here for sports or physio for the last couple of weeks. In addition to that, we'll see art galleries open, we'll see theatres and also cinemas. But we have had cinema owners say that they're not sure it's going to be financially viable because only having 20 people per cinema means that it's actually going to cost more to run the air conditioning than they're getting back in tickets. And the other concern that they have is that they're waiting on Hollywood blockbusters to be released from overseas, and they're obviously going to be delayed. So a lot of concerns for businesses who are looking at these new restrictions, and we're seeing people excited, we're seeing people out, but the main message is for people to also maintain those social distancing measures and be careful.
So why has the government decided to bring forward the second stage of eased restrictions then, Helen?
Well, here in South Australia, we haven't had a new case of COVID-19 since May the 7th, and we actually saw the first person that was admitted to intensive care at the Royal Adelaide Hospital. His name's Paul Faraguna. He was released last Thursday, and so that means there are no active cases currently in the state, and that is why we're able to have all of these restrictions lifted. But again, the Premier and the public health officials are all stressing that people have to maintain social guidelines so that we don't have a second wave. We will see some other things come back, like non-contact sport will start from Monday and contact sport training will also be back on from Monday. But those competitions won't be able to restart until June 25th.
Thanks, Helen. Well, the Prime Minister wants an overhaul of vocational education to help grow the economy after the pandemic. Scott Morrison will use a major speech today to warn how the recovery could take up to half a decade to return to pre-pandemic levels. Political reporter Dan Conifer joins us now from Canberra. Hi there, Dan. So what changes could we see in the TAFE sector?
Well, big ones if the criticisms the Prime Minister is going to level at the sector today are anything to go by. He says the national funding agreement when it comes to TAFE between the federal government and the states and territories is fundamentally flawed, with billions after billions year after year flowing into the sector from Commonwealth coffers without the Commonwealth actually being able to see how it's spent or hold the states accountable if they miss what targets there are in the system. That's the accusation that Scott Morrison will be levelling when he makes that speech at the National Press Club today, and says that if improvements need to be made in the sector to help grow the economy after the pandemic, to improve productivity, to get output of goods and services up to the levels they were before the pandemic, and therefore helping pay the budget debt and deficit off just that little bit faster. But he says that currently employers aren't getting employees with the skills that they need, that TAFEs aren't responsive to the skills that are needed in the economy, and that everybody is basically losing out of this system. Labor, for its part, says the coalition has ripped $3 billion out of this system since coming to power in 2013. Labor's Shadow Minister Tanya Plibersek says that there's no detail in this speech from what she's seen of it so far, and no time frame for when these changes need to be implemented, and no commitment of additional funding.
So what else can we expect from the PM's speech today then, Dan?
Well, he's going to be outlining the road back for the economy and says that could take between 3 and 5 years for the economy to get back to the levels that we saw just months ago before this pandemic brought the economy to a screeching halt, and that underemployment as well as unemployment will rise before they come down over that period of time, and that to help restart the economy there'll also need to be industrial relations reform as well as a look at tax reform and deregulation. But he says it will be a bumpy ride over the coming years and warns that mistakes will be made as we come out of the pandemic, Ros.
OK, Dan, thank you. The World Health Organization has suspended the use of hydroxychloroquine due to safety concerns. The health body had been using the malaria drug in its global study into experimental COVID-19 treatments. It's been touted by US President Donald Trump as a possible coronavirus cure, and he's been taking it as a preventative measure. But studies show people taking the drug are at high risk of death and heart problems.
The review will consider data collected so far in the Solidarity trial, and in particular, robust randomized available data to adequately evaluate the potential benefits and harms from this drug. The executive group has implemented a temporary pause of the hydroxychloroquine arm within the Solidarity trial, while the safety data is reviewed by the Data Safety Monitoring Board. The other arms of the trial are continuing. This concern relates to the use of hydroxychloroquine and chloroquine in COVID-19. I wish to reiterate that these drugs are accepted as generally safe for use in patients with autoimmune diseases or malaria. WHO will provide further updates as we know more.
New York Governor Andrew Cuomo has refused to give a date for when businesses in New York City will be allowed to reopen. Last week, Governor Cuomo announced that 2 regions of the state adjacent to New York City could soon reopen, as long as coronavirus deaths continue to decline. More than 29,000 people have died from the virus in New York State.
People can speculate, people can guess. I think next week, I think 2 weeks, I think a month. I'm out of that business because we all failed at that business, right? All the early national experts, here's my projection model, here's my projection model. They were all wrong. They were all wrong. Now, there are a lot of variables. I understand that. We didn't know what the social distancing would actually amount to. I get it. But we were all wrong.
In Britain, the Prime Minister's chief advisor, Dominic Cummings, has publicly defended his decision to drive 400 kilometres across the country during the coronavirus lockdown. Europe correspondent Linton Besser reports from London.
He was cool and calm and very polite and well-mannered. And he made clear his justification that he was in pretty difficult circumstances at the time. His wife was gravely ill. He was coming down with it. And he thought he had no better option, certainly no option in London, to care for his 4-year-old son. And up in Durham, 400 kilometres to the north, there was a vacant property, and he had 2 young nieces who had volunteered to care for his son in that worst case scenario. Here's a little bit of what Dominic Cummings said a short time ago.
I don't regret what I did. As I said, I think reasonable people may well disagree about how I thought about what to do in these circumstances, but I think that what I did was actually reasonable in these circumstances. The rules make clear that if you're dealing with small children, then that can be exceptional circumstances.
Now, where this becomes a bit more tricky is that he also took an 80-kilometre round trip to a tourist hotspot called Barnard Castle in the midst of all of this. Now, his excuse today was that he needed to test his eyesight after recovering from COVID-19 before embarking on the long 400-kilometre drive back to London, notwithstanding the fact you're not meant to get in the car and be driving around the country. Now, there's a couple of problems with that. One is, well, his wife could have driven, couldn't she? She has a driver's license. Another thing that was strange was that he packed his son in the car and his wife to test his eyesight on the road. And the only other thought to leave you with was the day that they made that trip to Barnard Castle happened to be his wife's birthday.